Hi everyone, Dr. Cary here. Thanks for joining me for this webinar called AI in Healthcare. We want to get you started with some practical first steps for doctors and therapists, clinicians who feel like you're behind. So if your colleagues are starting to talk about AI, you're hearing about it in the media, this is a good first step for you. I've been a health professional for 30 years and I'm keen on technology. We try to use as much technology in our practice as possible, but also being respectful of things like patient confidentiality, accuracy of the information, just ways that it's going to give us a more comprehensive, accurate approach to the patient's care. So I've spent over 3 decades in mostly my own practice, but I've been in a group practice. I've done some locums as well. So I've seen a lot of other practices, and I've worked with clients as well as a coach for B2B for doctors and therapists. I've watched AI move from novelty to genuinely useful. So a couple of years ago, people were talking about it, but didn't really know how to use it. And then, ChatGPT came along, Claude, some other Gemini, and it's become easier and easier to use AI and to implement it. But I'm also suspicious, and sometimes AI can make mistakes. It can kind of get off track or hallucinate. And it's important for us to keep in mind that it's not the be all and end all, like some people say it is. So today I'm going to show you what I tell my colleagues and clients, where to start, and just kind of to break you into the AI world for health professionals. So if you feel like you're already behind the pace, AI went from curiosity to everywhere in a single year. It has moved fast. There was no gentle on-ramp. It just kind of shot into the picture and it's gone very quickly. The noise, one camp says it'll replace you. The other says it'll harm your patients, and both are really exhausting if you listen to the noise. The load, documentation follows you home. At work, you have SOAP notes to do, you have patient charts, files, paperwork, and the new research coming out, it's hard to keep on top of. So, there's a lot of work, a lot of demand on doctors and therapists. And this is one area where AI can really help us to consolidate information and to highlight what's most important. So I really like it for a number of different things in the clinic, and I'll share that with you today. Just learn AI isn't a plan. The usual advice tells clinicians to dive in, pick tools, become fluent. It skips the part that actually matters. So number one, starting small, not big. One low-risk task this week beats a grand overhaul of your clinic that you'll never finish. Judgment stays with you. So AI notices and drafts. You decide basically what information you're going to take and what you're going to leave alone. And so that line never moves. It's not going to replace you. And then calm beats clever. So clinicians who do this well aren't the most technical clinicians. They're the ones who took this one step at a time. AI is your tireless virtual assistant. So before anything clinical, AI is brilliant at the tedious work that pulls you away from your patients. So drafting notes or letters. Of course, you want to leave the patient's name out, any identifying factors, but it can draft a good referral letter. It can draft a summary very easily if you give it the information. What I like to do with AI is I like to program it with instructions to prompt me multiple choice wise, so I can choose different variables, but also allow me to write in anything additional that's not in the choices. So I've got this multiple choice format that allows me to move through the prompts really quickly. It also helps with scheduling. So if you have your own practice, just scheduling staff meetings, following up with staff, delegating tasks to staff, it's excellent at doing that. It does work across text and images. Now, some AI is better for text, some is better for images. This morning I used Firefly for images for our PowerPoint for next month's webinar. And then text drafting documents, Claude and ChatGPT are very good at both of those. Even X-ray and lab reports, I've tested it with X-rays, removing the identifying factors, of course. It does a very good job, like a radiologist would, at reading X-rays. So lab reports would be similar. It would do a very good job of that, but you do have to keep an eye on it, because sometimes it'll miss, or as time goes on, it starts to deviate or get off track. So it'll learn your voice and it'll start to adapt to that. But again, you have to sometimes rein it in to keep it on track. Mistake costs a quick edit, not a clinical risk for you. So try this prompt. Draft a short, warm recall text reminding a patient they're due for a reassessment, under 40 words, plain language, signed from the clinic. So that's just something you can do in the AI of your choice. Core concept number 2, it's a thinking partner, not a replacement. So used while AI widens your view and checks your reasoning, especially when you're tired. So surfaces the possibility you didn't think of, pressure tests your reasoning at the end of a long day, notices the subtle finding. You make the call. You're the final say. And judgment stays firmly in your hands. So you can try a prompt like this. I'm reviewing a case and want to check my thinking. Here's what my working assessment, and then what am I possibly overlooking? Concept number 3, better care across the whole journey. So from the first conversation to follow-up, AI lightens the load at every stage. Communication can become clear notes and patient instructions, testing, high-yield tests, less redundancy, treatment, tailored plans to patients they actually followed, so it can be very customized, and then follow-up, timely check-ins that protect continuity. In my book on this topic that I wrote, it's on Amazon right now, and I'll give you the QR code in a minute. It talked about a doctor who would spend lots of time on Sundays doing paperwork. And because of AI, it's given her Sundays back. It's sped up the processing of information. It allowed her to enjoy her Sunday with family and not be in the clinic doing doctor notes. So she started small, an AI scribe for routine visits, reviewed and signed by her. Nothing about her clinical care changed. Within a month, Sunday was hers again. 4 things you can do this week. Get comfortable. Open your AI, ChatGPT, Claude, Gemini. Give it 3 non-clinical tasks, an email, a summary, a memo, and see how it responds. You sometimes have to prompt it with 2 or 3, like a follow-up, to get it to generate the response that you want. So you might have to add some detail to the prompt by responding to it. It's like having a conversation and refining that conversation. Pick 1 task, choose the repetitive non-clinical job that drains your week. Use AI on it daily. Number 3, improve a touch point, write 1 a patient handout in plain language. See if comprehension of that document improves. Number 4, mind the rule. Never paste identifying patient data into a consumer tool. De-identify first. So you just want to take the generic information. Now, if you're interested in what we have to offer here at True North Consulting, you can scan this QR code. It'll give you a menu of some of the different options. Like the book, you can read the book, AI in Healthcare, Step 1, same title as this webinar. It's on Amazon in paperback, ebook, and the audiobook is going through the approval process right now. So it's a calm, practical guide you can finish in an evening. Number 2, you can join our mastermind group. It's a small cohort, regular teaching on a weekly basis, and the accountability that make changes stick. So you get greater participation, You can interact with me, and we do it in a group format on Google Meet. You can raise your hand, ask questions, and we dive deeper into these concepts that I shared with you today. Or if you don't like the group format, then you can work one-on-one with me. The full program starts with an initial consult, one-on-one, and then I usually recommend sessions for follow-up, usually in a package of 13 sessions over 13 weeks or 13 sessions over 26 weeks, tailored to you and your practice. So I hope you enjoyed this webinar today. Hope to see you at the mastermind group or on a one-on-one consultation. And I hope you do pick up the book on Amazon so you can learn more about AI and how it can help you as a healthcare professional.